Welcome friends to Satu Career 2.0 online nursing channel. This is mock test series for nursing officer exams. AIIMS, NIMHANS, BHU and PGIMS Rohtak. Every day we are seeing 50 questions. As a part of that, today we are also going to see another 50 interesting and important questions for the upcoming nursing officer exam. Let us see the first question of the day. Before going to that first question, please subscribe to our channel if you are not a subscriber. Also click the bell icon to get the latest notification about all our new videos. Let's see the first question in this video. The expected respiratory rate of a neonate within 3 minutes of birth is A 40, B 60, C 80, D 100. So within 3 minutes of a birth of newborn, the expected respiratory rate would be option B 60 breaths per minute. Question number 2. Kayser fleischer rings, also called as greenish yellow pigmented rings, are found in option A age-related macular degeneration, option B glaucoma, option C Wilson's disease, option D dry eye. This greenish yellow pigmented rings, which is also called as Kayser fleischer rings, are seen in option C Wilson's disease. It is nothing but the deposition of copper in the side of the eyes. Question number 3. Needle used to suture delicate structures such as brain, intestine and nerve is option A straight needle, B round body needle, C swagget needle, option D half curve needle. So the type of suture needle used to, the right answer is option B round body needle is used to suture the delicate tissues like brain, intestine and nerves. Question number 4. AIDS in children is characterized by option A cryptococcus causing diarrhea, B rashes on extremities, C Kaposi sarcoma, option D recurrent candidiasis. So in children, the AIDS is characterized by option C Kaposi sarcoma. Question number 5. Breastfeeding is contraindicated if the mother is receiving option A antiretrovirus treatment, B insulin, C thyrotoxic drugs, option D is broad spectrum antibiotics. So when is breastfeeding contraindicated? The right answer, if a mother is receiving thyrotoxic drugs, that time breastfeeding is contraindicated. Question number 6. Low set ears in a child is a suggestive of option A renal anomalies, B extrophy bladder, option C tracheoesophageal fistula, option D congenital heart defects. The right answer is option A renal anomalies can be expected when you see a child with low set ears. Question number 7. What is the normal renal threshold of glucose? Option A 150 to 190 milligram per deciliter. Option B 160 to 180 milligram per deciliter. Option C 170 to 200 milligram per deciliter. Option D 120 to 150 milligram per deciliter. The right answer is option B 160 to 180 milligram per deciliter is the normal renal threshold of glucose. Question number 8. The most commonly involved cranial nerve in diabetes is option A oculomotor, B abducens, C optic, D trigeminal. The right answer option A oculomotor. The third cranial nerve is commonly involved in the diabetes patient. Question number 9. A 35-year-old male has been an insulin-dependent diabetic for last 5 years and is now unable to urinate. The following is most likely to suspect. Option A atherosclerosis. Option B diabetic nephropathy. Option C autonomic neuropathy. Option D somatic neuropathy. This question yesterday also we have discussed in the video. So the right answer is option C autonomic neuropathy. Question number 10. Identify this type of bandage in the image. Option A spiral, B spica, C figure of eight, option D triangular. This type of bandage is known as figure of eight bandage. Question number 11. What is the most common malignancy of childhood? Option A leukemia, B Wilms tumor, C retinoblastoma, option D uroblastoma. The most common malignancy of childhood is option A leukemia. Question number 12. Which of these medicine is contraindicated in a patient with gastritis? Option A naproxen sodium, B calcium carbonate, C azithromycin, D furosemide. So in gastritis, the drug which is contraindicated is option A naproxen sodium. Question number 13. Which of these is a late sign of increased intracranial pressure? Select all the apply. Option A papilledema, B sunsetting syndrome, C seizures, D bulging fontanelle. So the late sign of increased intracranial pressure is option A papilledema and D bulging fontanelle. Question number 14. The part of mind which distinguishes right from wrong and acts as a sensor of behavior is called option A ego, B id, C superego, D libido. The right answer superego, option C, which distinguishes the right from wrong and it acts like a sensor behavior in our mind. Question number 15. The group of drugs that cause the major side effects of nephrotoxicity and ototoxicity are option A penicillin, B sulfonamides, C erythromycin, and D aminoglycoside. The right answer is aminoglycosides causes ototoxicity as well as nephrotoxicity. Question number 16. What is the right time of Apgar score after birth of newborn? Option A after 1 second, B after 1 minute, C after 5 minutes, option D both B and C. The right time to check Apgar score after birth of a newborn is after 1 minute as well as after 5 minutes. We can check the Apgar score. So option D, both B and C is right. Question number 17. The type of hepatitis which caused after blood transfusion is option A hepatitis A, B hepatitis B, C hepatitis C, and D is hepatitis D. The right answer is option C hepatitis C. Question number 18. The earliest clinical sign in idiopathic respiratory distress syndrome in an young infant is usually option A sternal and subcostal retraction, B cyanosis, C grunting, option D tachypnea. The respiratory rate is above 60 breaths per minute. The right answer, the earliest clinical sign in idiopathic respiratory distress syndrome in an young infant is tachypnea, where the respiratory rate is above 60 breaths per minute. Question number 19. The common acute complication of meningitis in young children is option A SIADH, syndrome of inappropriate antidiuretic hormone, option B is motor deficit, option C is hearing loss, option D is language deficit. The most common acute complication in meningitis is option A SIADH, whereas all other or the complications are a chronic period of time. Question number 20. What is the initial nursing action for a penetrating eye injury? Option A cover with sterile eye patch, B visual acuity test, C lubricate the eye with lukewarm water, option D remove the piece of wound using a sterile eye clamp. The initial nursing action for a penetrating eye injury is option A cover with sterile eye patch. Question number 21. What instruction should the nurse include in the plan of care for the glaucoma patient? Option A avoid overuse of eye, B decrease fluid intake to control the intraocular pressure, option C decreasing the amount of salt in diet, option D administration of eye medication for long time. So in plan of care, the instruction the nurse will include for a glaucoma patient is option D administration of eye medication for long time. Question number of 22. Which of the following findings suggests ulcerative colitis? Option A large amount of fresh blood in stool, option B small amount of fresh blood in stool, option C rice water stool, option D is diarrhea with pus and blood. In ulcerative colitis, diagnostic finding will be presence of pus and blood in the diarrhea. Question number 23. Most common shock in children is A. Septic, B. Neurogenic, C. Cardiogenic, D. Hypovolemic. The common shock in children is option D. Hypovolemic shock. Question number 24. Which is the complication of blood transfusion? Option A increased serum albumin, B hyperkalemia, C hyponatremia, D hypercalcemia. The most common complication of blood transfusion is option B hyperkalemia. Question number 25. Identify the name of the procedure in the image below. Option A electrocardiography, B electromyography, C. Transcutaneous electrical nerve stimulation. Option D. Vagus nerve stimulator. So the image shows the procedure called electromyography. Next question. Deficiency of which immunoglobulin causes septicemia? A. Immunoglobulin A. B. Immunoglobulin G. C. IgE. D. IgM. Septicemia occurs because of the deficiency of IgM. Question number 27. Skin taken from unburned area of the client's own body transplanted to cover the burn is known as A. Allograft, B. Xenograft, C. Autograft, D. Homograft. The right answer is option C. Autograft. Question number 28. Minimum scrubbing time for hand wash is A. 1 minute, B. 2 minutes, C. 3 minutes, D. 5 minutes. So minimum scrubbing time for hand washes, option A, 1 minute. Question number 29. What is the primary action of insulin in the body? Option A, enhances the transport of glucose across cell walls. Option B, aids in the presence of gluconeogenesis. Option C, stimulates the pancreatic beta cells. Option D, decreases the intestinal absorption of glucose. So the primary action of insulin in the body is option A. It enhances the transport of glucose across the cell walls. Question number 30. Neonates of mothers with diabetes are at risk for which complications following birth? Option A, atelectasis, B, microcephaly, C, pneumothorax, and D, macrosomia. So the complication of neonate who born for mothers with diabetes will be at risk of macrosomia. Question number 31. Nurse Yamuna is assessing a client with Parkinson's disease. The nurse recognizes bradykinesia when the client exhibits option A, intentional tremor, B, paralysis of limbs, C, muscle spasm, option D, lack of spontaneous movement. So here the bradykinesia when the client is diagnosed with Parkinsonian will exhibit option D, lack of spontaneous movement. Option D is right. Question number 32. Which of the following toys should the nurse recommend for a 5-month-old baby? Option A, a big red balloon. B, a teddy bear with button eyes. C, a push-pull wooden truck. Option D, a colorful bushy box. For a 5-month-old baby, the toy can be suggested is a colorful busy box. Question number 33. A male client who has suffered a cerebrovascular accident is too weak to move on his own. To help the client avoid pressure ulcers, the nurse should option A, turn him frequently. Option B, perform passive range of motion exercises. Option C, reduce the client's fluid intake. Option D is encourage the clients to use a footboard. So in order to avoid pressure ulcer, the nurse should turn the patient frequently for every 2 hours. Question number 34. Nurse Simi receives emergency laboratory results for a client with chest pain and immediately informs the physician An increased myoglobulin level suggests which of the following? Option A, liver disease, B, myocardial damage, C, hypertension, D, cancer. So when there is myocardial infarction, that is when there is damage to myocardium, the myoglobulin level is increased in the laboratory investigation. So option B is right here. Question number 35. Your patient is complaining of muscle cramps while undergoing hemodialysis. Which intervention is effective in relieving the muscle cramps? Option A, increase the rate of dialysis. B, infuse normal saline solution. Option C, administer 5% dextrose solution. Option D is encourage active range of motion exercise. So a client who undergoing hemodialysis complaining of muscle cramps, the intervention which is effective to relieve the muscle cramp will be to start infusing normal saline solution. Question number 36. Which of the following is considered a bronchodilator? Option A, acetylcysteine. B, guaifenesin. C, theophylline. Option D is epinephrine hydrochloride. The bronchodilator is option C, theophylline. 37. A patient with diabetes has had many renal calculi over the past 20 years and now has chronic renal failure. Which substance must be reduced in this patient's diet? Option A, carbohydrates. B, fats. C, proteins. D, vitamin C. So in case of renal calculi and who is having chronic renal failure for the past 20 years, the substance to be included in the patient diet should be the substance to be reduced in the patient diet should be option D, vitamin C. Question number 38. A nurse assists in the vaginal delivery of a newborn patient. After the delivery, the nurse observes the umbilical cord lengthen and a spot of blood from the vagina. The nurse documents these observations are the signs of option A, hematoma, B, placenta previa, C, uterine atony, option D, placental separation. So these findings suggest that a client is having a separation of placenta. Option D is right. Question number 39. Nurse Tanu is aware that most appropriate for a client with Addison disease is option A, risk for infection, B, excessive fluid volume, C, urinary retention, option D, hypothermia. So client with Addison disease is prone to develop risk for any kind of infections. Move on to 40th number question. A nurse is suctioning fluids from a male client via tracheostomy tube. When suctioning, the nurse must limit the suctioning time to maximum of option A 1 minute, B 5 minute, 1 minute, option B is 5 seconds, C is 10 seconds, D is 30 seconds. So the maximum time for suctioning allowed is option C is 10 seconds. Question number 41. The position used to promote comfort in acute appendicitis patient is A. Fowler's, B. Lie on his abdomen, C. Lie on supine with extended legs, option D. Lie on supine with knees flexed. The correct answer is for giving comfort to acute appendicitis patient. The patient should be made to lie in supine with the knees or flexed. Question number 42. A client has undergone gastrectomy. Nurse is aware that the best position for the client will be option A is left side lying position, B low Fowler's position, C prone, and D supine position. So in this case, the best position for the client who undergone gastrectomy will be option B low Fowler's position. Question number 43. Which of the following assessment indicates that the patient is bleeding from the stomach? Option A, clay colored stool. B, black tarry stools. C, stool with frank bleed. Option D, coffee ground like stool. So the finding which tells the patient is having bleeding from the stomach will be option B, black tarry stools. Question number 44. Which of the following psychiatric disorders are comparatively common in female except option A, bipolar affective disorders, option C, transvestism, option D, social phobia, option D, anorexia nervosa. So here in the answer you want to know that the disease which is commonly present in female will be anorexia nervosa, but here they ask the except. So when it is except option A, bipolar affective disorder, it is comparatively, it is mostly present in the we can see this bipolar affective disorder, not bipolar affective disorder. Here the right answer will be the transvestism. So when it comes as except, transvestism should be right. Otherwise, anorexia nervosa is the most commonly present in the female. So here the right answer will be transvestism. Question number 45. A client having abdominal discomfort after ingestion of milk. It indicates genetic deficiency of which enzymes? Option A sucrose, B lactase, C maltase, option D is amylase. The right answer is lactase. Question number 46. Question number 46. Which test is commonly used to find out the number of motility and activity of sperm? Option A protein electrophoresis, B CMP test, C PCR test, and option D is Hunner's test. The right answer is option D, Hunner's test. Question number 48. The shortest diameter in the fetal head is option A biparietal diameter, B suboccipitofrontal diameter, option D occipitofrontal diameter, and option D is bitemporal diameter. The shortest diameter in the fetal head is option D bitemporal diameter. Question number 49. A patient received 6 units of regular insulin 3 hours ago. The nurse would be most concerned if which of the following was observed. Option A, Kushmal respiration and diaphoresis. Option B, anorexia and lethargy. Option C, diaphoresis and trembling. Option D is headache and polyuria. So 3 units of insulin was given, sorry, 6 units of insulin was given 3 hours ago. Then the symptom which gives much concern for the nurse would be option C, diaphoresis and trembling sensation. Question number 50. Polyvalent vaccines consist of option A, most strains of the same species, option B, a single organism, option C is most strains of different species, Option D is a single species. So a polyvalent vaccine will consist of more strains of different species. Option C is right. So here we come to the end of today's video. We have seen the 50 important questions for the upcoming nursing officer exams. This is the end of this video. Thanks for watching this video. If you like these videos, please click and you can watch these videos too. And don't forget to subscribe our channel, and please like this video and write comment about this video. Meet you again with another good 50 questions. Till then, take care all. Bye bye. Good night.